The U.S. Family Health Plan is a U.S. Department of Defense plan that serves military family members and retirees. It currently delivers the full TRICARE Prime benefit for more than 145,000 beneficiaries. The U.S. Family Health Plan is an amazing health plan. We offer high quality, high patient satisfaction for all of our beneficiaries. And our vision is to really simplify healthcare for everyone. The last thing that we want to do for our beneficiaries is to complicate the system or have them have challenges when they're trying to get just basic healthcare or care when they really need some acute or serious care. And I think that should not only be the vision of U.S. Family Health Plan, but us as healthcare providers across this country.
Part of this paradigm in which we operate, and again, which is unique among all of the managed care contractors that DoD engages with, is a focus on prevention and wellness, a focus on making sure that access is unimpeded, that people are hooked up with the providers they need when they need them.
We feel responsibility for their care across the spectrum of wellness to illness. And so understanding our population is a high priority. We are very strong advocates for strong primary care, and every member of our health plan has a primary care clinician with whom we are most emphatic that they have a relationship.
It's a trust relationship, and based on the nature of our program and the enrollment, they're basically in the family, and we reach out to our beneficiaries all the time, not just the 15 minutes they're sitting in front of a doctor. They know us, and that matters. And that leads to the satisfaction that some of my colleagues have talked about.
For a guardsman to come out, a citizen soldier to come out of the service and walk into this quality of care, it's extraordinary.
U.S. Family Health Plan is unique across the entire military healthcare system because it is the only fully at-risk managed care plan that the Department of Defense offers. And what that means is the government pays the programs a fixed annual premium for each member who enrolls in the health plan. The expectation is over a period of time, you tailor the patient's care and needs to the specific population and even down to the specific individual. And the optimal objective is to provide the right care in the right place at the right time.
We allocate resources for that set of activities in a much more aggressive way than most health plan services do. And it yields lower cost, and it yields better quality and better patient experience. It is regional, and it is delivery system based. And what that really permits is the development of care systems that are continuous and reliable, as opposed to a contracted model where there is really less orientation around care and more around the financing mechanism.
It's a great model. I do not understand why it is not promoted more for TRICARE agencies around the country. I just don't understand it.
Family readiness is a critical component of the military medical readiness mission, and so we have to be clear. We have to have the uniformed services active duty back. We have to have their back, and when they're in theater or they're deployed protecting us, we need to make sure that we convey that we have got your family. So we take our commitment to the readiness mission seriously. We're actively engaged in it, and we always try to kind of raise the bar and make sure that we've got the military mission in the forefront of everything that we do.
My wife injured her foot a few years ago and finally got to the point where she couldn't put any weight on it. The efficiency and the quality of care that my wife got was exceptional. There was an obligation made at one point, especially to all our veterans, that we've asked them to do a lot of stuff that the civilians are not tasked to do. That there is an obligation there. And this plan is one of the great ways to do it. And still, I know cost is a big factor, And I think this is probably one of the better ways they can help live up to that promise.
And if you think about it, the military health system is a microcosm of the healthcare industry. Although, I don't think anybody would argue, it has the privilege of serving a population who have earned the right to healthcare. Although everybody deserves it, this group has obviously earned it. So it actually it raises the bar in it for all of us.
I can't emphasize to you enough this quality of care for people who have stepped forward for our country. As Mike said, it's an assurance of something that we gave those people when they put their hand up. To think that people in our government would start to tweak this operation to make a buck, if that is what it comes down to, is a travesty. You have to support this type of operation. These people are really doing a service. Don't let them down.